In this video, we will be performing a routine venipuncture on a live patient. This is also known as phlebotomy. Phlebotomy is the surgical opening or puncture of a vein in order to aspirate blood. Each sample collected is used to monitor a patient's health status.
After you have introduced yourself to the patient, you will need two identifiers to verify that you have the correct requisition form and patient, such as their name and date of birth. Have a seat, please. Hi, my name is Kristen. I'm from the lab. I will be needing to draw 2 tubes of blood today. Is that okay?
Yeah.
Okay. Can you verify your name and your date of birth, please?
Last name Long, Long. First name Leah, Lea. Date of birth 12/26/95.
Okay. Hand washing technique. Step 1. Wet hands with warm water. Do not allow parts of body to touch the sink. Step 2. Apply soap, preferably antimicrobial. Step 3. Rub to form a lather, create friction, and loosen debris. Thoroughly clean between the fingers and under the fingernails for at least 20 seconds. Include thumbs and wrists in the cleaning. Step 4. Rinse hands in a downward position to prevent recontamination of hands and wrists. Step 5. Obtain paper towel from dispenser. Step 6. Dry hands with paper towel. Step 7. Turn off faucets with a clean paper towel to prevent recontamination.
Dry hands with paper towel.
Next, gather required materials. This includes gloves for both hands, a needle, a hub to hold the tube in place, alcohol pads to cleanse the site of puncture, gauze to absorb excess blood, Coban to apply pressure to the site, a tourniquet to accumulate the blood in the veins, making them accessible, vacutainers to collect the blood sample. When selecting a site for venipuncture, there are 3 major veins: the median cubital, the cephalic, and the basilic. The preferred site is the median cubital. The median cubital vein is the vein of choice because it is large enough not to roll when the needle is inserted. It is often closer to the surface of the skin and is the least painful to puncture, with fewer nerves in this area. The cephalic vein is located on the thumb side of the arm. It is usually more difficult to find and has more tendency to move. This vein should be the second choice if the median cubital is inaccessible in both arms. The basilic vein is located on the inner edge of the arm, near the median nerve and brachial artery. This vein has a tendency to roll, and a hematoma is more likely to form. The basilic vein should be used as the last choice because the median nerve and brachial artery are in close proximity to it, increasing the risk of permanent injury. Tourniquet application. Have you ever gotten your blood drawn before?
Yes, this past Monday.
Okay, may I see your arm, please? Okay, looks like you have a bruise over here. We'll try to go for this arm.
Alright.
Okay, I think I see one. Position the latex tourniquet 3 to 4 inches above the venipuncture site. Grasp both sides of the tourniquet and, while maintaining tension, cross the tourniquet over the patient's arm. A properly applied tourniquet will have the ends pointing up away from the venipuncture site. Once you have selected your preferred vein, pull the end of the loop to release the tourniquet with one hand, and the tourniquet only be on for 1 minute. Now we are ready to assemble the needle and hub. Twist and pull off the cap with the rubber-covered needle. Be careful because the outside is rubber, but underneath is a sharp needle used to poke into the vacutainer. If you push hard enough, you could stick yourself. Then screw the needle to the hub. Personally, I prefer to ready my vacutainer inside the hub, but don't puncture just yet. Reapply your tourniquet following steps 1 through 5. Palpate if you need to. Then cleanse the area with an alcohol pad in a circling outward motion. Once you have cleansed the area, you cannot palpate again. Do not blow or fan to dry the area due to contamination. Wait for it to dry on its own. While the area is drying, I will explain the order of draw from left to right. Blood cultures are ordered as a set of 2 bottles, aerobic and anaerobic. Aerobic requires the presence of oxygen, and anaerobic does not for certain organisms to grow. These bottles are incubated up to 5 days. It is a test to culture bacteria or fungi that may lead to an infection in the blood. The blue tube consists of sodium citrate. It determines coagulation tests, heparin and warfarin controls, thrombophilia, lupus screens, and others. The red tube is used to test therapeutic drugs. It doesn't contain any additives because they may alter the results. The yellow Integra tube contains a gel separator that you must allow to clot for half an hour. These test for CMP, BMP, including a cardiac panel, TSH, free T4, and PSA. The green tube contains a heparin coating. It is used to heparinize plasma or whole blood for special tests. The purple lavender tube contains the anticoagulant EDTA. It is used for most hematological tests, such as CBC with differential. Now that the collection site is dry, you'll reapply the tourniquet. Today we will be drawing a purple top tube and a tiger top tube to test for TSH, free T4, and a CBC with differential. Then with the bevel facing up at approximately a 30-degree angle, because we are using a straight needle, you won't know if you are getting a flashback. With the vacutainer ready in the hub, push in to collect your sample. You'd want to try and fill 3/4 of the tube. Then steadily remove the tube, not the needle, and place the next tube. When switching tubes without causing the patient discomfort, you want to steady your hand against the arm. Then you can pop the next tube in without pushing the needle any deeper. In the middle of the last tube, remove the tourniquet. Finish and immediately invert the tubes 10 times. Do not shake. Prepare your gauze above the needle but not directly on it. Pull out the needle at the same angle you went in. Place the gauze over the puncture quickly. Clip the safety guard up to cap the needle and discard in the sharps container. Hold pressure on the gauze for about 5 minutes to prevent bruising. Wrap the patient's arm and gauze with Coban. It can be removed after 15 minutes. And after 15 minutes, you can take it off. Make sure you label all the tubes. Again, ask the patient to spell their last and first name and date of birth on site. Other information includes today's date, time of draw, and initials of phlebotomist. Thank the patient and see if they have any questions or need anything.
Are you feeling dizzy, lightheaded?
No, but I have a question. When will my results be in?
The test we're running takes about an hour or 2. The results will be given to your doctor. You can notify him.
Okay. Thank you.
Thank you.
Next, clean your station and sanitize the seating area for the next patient.